EMS skills. We're talking about 14 components of the EMS system. You got public access, you got communication systems, you have clinical care, you have human resources, medical direction, legislation and regulation, integration of health services, evaluation, information systems, system finance, education systems, prevention, public education, and EMS search. You see here, we're talking about the emergency medical service system, everything just kind of goes in one circle, and everything just kind of works to lead to the other. Public access, always remember that easy access to help in an emergency is always essential. The easier it is to get help, the quicker and better it is. And 911 system is a public safety access point. Years ago, we didn't have 911, so you had to remember numbers to call. You had to call a certain number for the department, a certain number for the fire department, and a different number for EMS. Today, you can call 911 and have access to all the different agencies that you need. Emergency Medical Dispatcher EMD system gives callers medical instruction after EMS arrives. And what this does is we have these here at Wayne County. It's dispatchers that are trained in emergency care. They can actually walk patients and family through care until we there, such as if a family has somebody that goes down and needs CPR. These dispatchers can walk them through that. They can walk through things such as applying pressure, to help stop bleeding, different things like that. And from the caller information, the dispatcher selects the appropriate parts of the emergency system to activate. EMS can be part of a fire department, such as fire EMS, can be part of a police department, or it can be independent. And new technology helps responders to locate their patient, such as cellular telephones linked to GPS units. These have been a big help, especially since a lot of counties are starting to change road names and going to the new mapping system with 911. Talking about clinical care, this describes the pieces of equipment that are used, and it also describes the scope of practice for using that equipment. Clinical care also permeates with ambulance controls and their primary service area. We talk about human resources. Human resources focuses on people who deliver the care, trying to make sure everybody gets compensated, trying to make sure there's interaction with other members of the medical community and the well-being of those involved. And efforts are underway to allow EMS providers to move from state to state. Medical direction is a physician medical director authorizes EMTs to provide medical care and appropriate care described in standing orders and protocols. At Wayne County, our physician medical director is Dr. Corey Ryan. A lot of times, everything that we do as a EMS agency has to go through and be approved by him. We're talking about medical control. It can be offline or online. When we talk about offline or indirect, we're talking about standing orders, training, supervision. And we talk about online or what we call direct medical. We're talking about where the physician, our directions are given over the phone or radio. It's where we actually call the physician, can we do this, or what do you want us to do at this time? Legislation and regulation, training protocols and practice follow the state legislation. And senior EMS officials, they have administrative tasks such as scheduling, personnel, budgets, purchasing, vehicle maintenance. And as you work in the EMS field and advance on over the years, you may find yourself in some of these positions where you're taking care of these tasks yourself. Pre-hospital care by the EMT is coordinated with care administered by the hospital. We don't just take a minute of it. We start the care and we go in, and the care is continued on. And this care simply continues in the emergency department. What we do, they continue on to try to make the patient better. And this ensures patient receives comprehensive continuity of care.